obviously. And welcome everybody. And we're gonna review the physical activities and what are the benefits of keeping healthy, especially in the age like senior age group or the declining age. Even these tips are equally benefit for the young as well, to keep them very active throughout. So the aim of this presentation is the guideline. There are supplementary things what I will present to you. The number one is that I will discuss with you some of the things, like if you are going to your physical checkup or family physician appointment, then what you should know and what you may ask the family physician. That's also important. And similarly, I will also share in the beginning some part of a small video, like how the Canadian government trained us that what you should ask, uh, the patient, and how you can ask to the doctor as well. Okay, so the what should be the interview techniques, and what are the requirement of the interview while you are visiting your doctor. I will try to discuss with you some of the things which are primarily the home. You can do something in the home and you don't need to go to the doctors. But that is also something we will discuss. So let's start. And after that, we'll have a question answer session. And in the question answer session, you are feel free to ask me any question. Okay. So let me start with a part of a small presentation for your just. So this is a presentation.
Dr. Saab, it is interactive. You said in poster it says interactive. Now you're saying is a question and answer is afterward.
As you like.
Okay. Good enough.
Whatever Mr. Shokat decide.
Okay. No, I would like it to have interactive.
Okay. If you want to have like that's not a big issue. We can do it.
Interactive, also participative, both.
Okay. Let me share the screen. Can you see my screen?
Yes.
Norman.
Good morning, Doctor.
How are you today?
Well, mostly okay.
Your learning objectives for mastering the head-to-toe assessment of older adults are to adjust your interview techniques and office environment to the needs of older adults, to learn the importance of functional assessment and screening for preventing falls, to master the skills of physical examination for older adults. Older patients experience physiological changes over time that require the attentive clinician to make specific adjustments to the examining room and their techniques of interviewing. Provide a well-lit, moderately warm setting with minimal background noise and safe chairs and access to the examining table. Face the patient and speak in low tones. Make sure the patient is using glasses, hearing devices, and dentures if needed. Adjust the pace and content of the interview to the stamina of the patient. Allow time for open-ended questions and reminiscing. Listening to this process of life review provides important insights into the older adult's outlook and health concerns. Include family caregivers when needed, especially if the patient has cognitive impairment. Make use of the useful brief screening instruments for geriatrics, the past medical record and listing of medications, and reports from allied disciplines. Carefully assess symptoms, especially fatigue, loss of appetite, dizziness, weight loss, and pain, for clues to underlying disorders and geriatric syndromes like falls. Make sure written instructions are in large print and easy to read. During your discussion, assess the patient's ability for self-care to learn if the patient can perform various activities independently, needs help, or is entirely dependent on others.
Mr. Norman, do you need any assistance in the mornings with dressing or bathing?
Ask about the patient's capacity to perform activities of daily living, or ADLs, consisting of basic self-care abilities such as bathing, dressing, toileting, transferring, continence, and feeding.
Do you go shopping by yourself and prepare your own meals?
Then move on to inquiries about the patient's capacity for instrumental activities of daily living, or IADLs. These include higher-level functions, such as using the telephone, shopping, preparing food, housekeeping, laundry, transportation, managing money, and especially taking medicine. Approximately 80% of older adults take at least one prescription drug each day. Roughly 30% take more than 8 prescribed drugs each day. Be sure to take a thorough medication history for each drug, including the medication's name, dose, frequency, and indications. Explore all components of polypharmacy leading to suboptimal prescribing, including concurrent use of multiple drugs, underuse, inappropriate use, and non-adherence. Ask about use of over-the-counter medications, vitamin and nutrition supplements, and mood-altering drugs. Assess medications for drug interactions.
Mr. Norman, I notice you're rubbing your leg a lot. Are you having some pain in your leg?
As pain and associated complaints account for 40% to 80% of clinicians' visits, learn to distinguish acute pain from chronic pain and thoroughly investigate its cause. Pain usually arises from musculoskeletal complaints, such as back and joint pain.
Oh, I feel creaky in the mornings, but I tend to get around okay.
Be aware that older patients may be reluctant to report painful symptoms. They may even overestimate their healthiness. The patient may be embarrassed, afraid, or eager to avoid medical expenses or the discomfort associated with treatment. For these reasons, it is best to utilize open-ended questions that encourage patients to talk about their state of health. Questions might include,
Do you have any special concerns today?
or,
Are you having any pain or discomfort in your daily activities, Mr. Norman?
at each visit, advise your elderly patients who smoke to quit, as quitting is a crucial step to reducing risks for lung cancer and heart disease.
Okay, I will stop for a while. There is a comment by a gentleman that this video is meant for the doctor, and you are correct. It is meant for the doctor. But it is important that you should know what we are trained for and what you are expected to discuss with your doctor, and how your family physician and doctor should behave with you, like what time and what proficiency and what professional attitude you expect from your doctor, which is unfortunately sometimes lacking whenever you go. So this video, just a part of a video I showed you, maybe you have gone through two components. The general is the general interview techniques, and the second one is the asking a specific question about the activities of daily living and instrumental activities of the daily living. Why it's important for you? Because it shows the health deterioration. Okay, so let me just go to some of the things that what you have just learned so much. Okay, so
Dr. Saab, Some people are raising their hand and you can decide when to take the question.
You can, we can take right now. Yes, please go ahead.
Actually, nowadays, when you go to the doctor, you can only talk about one problem, and they have only 10 minutes or less than 10 minutes. It's just like assembly line, and you cannot explain things what this doctor is asking. We don't get this kind of experience in Canada anymore. So I think, is it worth it or not? I don't know.
May I make a comment? I mean, I see this video from a different perspective. I think it's making us aware that what we must be telling to our doctor about these things. Normally we are shy, we're ignorant, or we don't want to tell them, but I think these informations are very critical for the doctor to make a correct assessment. So I'll say proactively, if this question not asked, then you can describe which is which. But I agree with Anwar, but that is one, that one is for one complaint. But what he's showing is you are describing your condition. For one complaint, they see one visit. So you can still make aware your doctor about these limitations. That's what I see it from here.
Yes, actually, it is very difficult for a doctor to address a lot of complaint at the same time, as you indicated, due to the paucity of the time or due to the number of patients waiting for the other. So there are some limitations for the doctors as well. However, you should, like this video, basically it cover all the condition, like generally what are the problem with the elderly. So you can select that these, even in my presentation, I'm going to present right now, and some of you have seen that presentation, or maybe some of you have not seen that presentation. So you will see that I will cover a lot of things. And the idea is that these things are important for you. It is important that what question and what concern are important at this point of age. So another question, anybody else? Yes, Anwar. Is it fine? Can we continue?
Sorry, yeah, I am done. Sorry about that.
Okay, okay. So let me go to a quick review of two things, what you just saw in the, so everybody can see my slide?
Yes.
Yes,
okay.
yes, doctor.
Okay, so this is, just let me go to the full slide. So can I go the full slide? Okay.
So it's okay. You can carry on. That's okay.
It's okay. If it is okay, size is okay.
Yeah,
Okay.
It's okay. Okay.
No problem. So the activities of daily living and the instrumental activities of daily living. Basically, if you look on the left side of the slide, then just a minute. I want to use the cursor basically, so that I cannot use.
We can see the cursor. We can see your cursor.
No, just a minute. So now you can see here. So the laser pointer. So sorry.
Yeah.
Now you can see the full slide, right?
Yeah.
So basically, if you look, these are the first thing, like in a healthy individual, you should be able to do the IADL. So instrumental activities of daily living, like you should be able to do the shopping, housework, accounting, managing finance, banking, food preparation, transportation, telephone usage, including the cell phone, and taking your medication properly. So these are the, but once the patient condition deteriorate and the patient cannot do these things, then patient go to this one. ADL is the next step of deterioration. Like the patient can, but still patient can do something like ambulate or taking bath or continence, going to the washroom, dressing, eating and transferring and toileting. So my point was that in your video, in interview, if you have any difficulty in these things, these are the points you should discuss with your family physician. Okay. I think it's better that if I will start with my video now, and then I will go again to the, I will start my presentation and then I will go on the video. Anybody has any other question? So, so I'm also reading the chat, and Shaheen said this will have comment. Okay. Okay. So let's start my presentation first so that you have a good idea what we're going to discuss the thing. Before I will go to the presentation, I will just show you one more thing, and that is about the or the form what the doctor have, like what are the screening program. I think I will show you that form later on. Let's finish the video first. So basically this video showing the what are the physical activities important for you, and the new program has been launched in 2020 by Canadian government. We call it Canadian 24-hour movement guideline. So it is an integrated physical activity program to avoid the sedentary behavior and to improve the sleep in patients who are, I should not use the word patient, I should use adult. So adult 65 year or older. So these are the three important points. Okay. So you can see the physical activity, number one, and number two is the sleep, and number three is the sedentary behavior. We will see that what is the difference in these. So we call it healthy 24-hour. So 24H. So healthy 24-hour program of the Canada. The physical activity. So various activities including the aerobic exercise. And what is the meaning of aerobic exercise? Aerobic exercise is one when, depending upon your age, it increases your heart rate. So your heart rate should increase. Okay. Whatever you do, whether you are walking, brisk walk, or you are on the doing some up stair or down stair, or if you are doing, let's say, a treadmill, that's fine. Whatever you are doing, so that should be at least 150 minutes per week. That is the minimum requirement to keep your heart healthy and to keep your circulation along the lungs. And it will, if you are using your muscle, then it will improve the muscle. And the muscle strength is much important at this age because it will prevent you from fall. Okay, so that is the important one. The muscle strengthening can be done by different exercise. So exercise are divided into three main groups. You are involved in the with Shakeel Sahab, so you know the exercise program. One is called stretching exercise. Stretching exercise, they are non-aerobic exercise. So they stretch, for example, if you stretch any group of muscle and then go, so that's the stretching exercise. Another is the muscle development exercise. So for example, if you lift some weight, so basically you are building the muscle. Okay, so that is the muscle. Sometimes we call it in a simple way bodybuilding. That is another terminology used for that. But these two exercises are not good for, like they are not recommended for the heart health. What we recommend for the heart health is the basically the the aerobic exercise. So that aerobic exercise is required, and this aerobic exercise, as I told you, that it should be um, by increase in the heart rate and increase in the respiratory rate. Okay, so that's the number one point. Second point is the sleep. Uh, at this stage, you should have 7 to 8 hours of good quality sleep. Okay, that is sleep hygiene is also important for you. So make sure that you have the good sleep hygiene. Okay, so that is the sleep. And the third one is the limit your time to sofa set or on chairs or on a screen time. Okay, so a screen time in 24 hours should not be more than, rather the correct word is it should be less than 3 hours. These are the recommendation by Health Canada nowadays. Uh, if you have any question, and let me finish this topic and then the whole day matter. So 65 plus adult, uh, so around between 50 to 65, we call it middle age, and then 65 plus, we are discussing more. So move more, reduce sedentary time, and sleep well. 3 point. Very simple 3 point. Number one, movement. Number two, movement mean brisk movement or up or down movement, and reduce sedentary. So you can stand up, you try to do your, for example, vegetable cutting or making a fruit bowl of fruit salad. Uh, Try to stand up and then do it. Okay, and sleep well, 7 to 8 hours sleep. Right. Uh, so we have discussed the what could be the activity you can depend upon, depending upon the weather, depending upon your home environment, depending upon the activities available with you. So you can do. Now in the winter, you can go in the mall. They are conditioned mall, so you can. But in the COVID situation, it's very difficult to make these movements. Anyway, these are the physical guidelines for the movement. So casual neighborhood walk, they are perfectly fine even in the COVID situation. Gardening, not now, but if the weather permit, you can do the gardening, household, and taking stairs instead of elevator when you are going to some job or something, and parking your car a little bit away from the store, so you can walk. That will be a compulsory walk. Okay, so that these are some habit. Reduce your screen time, as I told you, that it should be no more than 3 hours. No more than 3 hours of recreational screen time. Okay, you must break up some time and you must give some ease to your muscle, to your body, to your eyes, and to your ear. It's recommended that don't use earphone. So earplugs or earphone, they are basically not recommended because they can damage sometimes accidentally the voice. So it is, try to, if you are looking at the, try not to use cell phone, but rather laptop is a better option because they're bigger, and try not to use. Shine Sab, you have any question?
Yeah, Dr. Saab, yeah, you said we should have a sleep of 7 to 8 hours.
Yes,
Means it is in one stretch, or because Muslim seniors, they have a sleep in two
that's
parts.
fine. That's
Yeah,
fine. That's fine. So it is the total. Okay.
it is a
So
total.
that
Yeah,
total is time, sleep time. It
yeah.
can be like 2 or it can be in 3, doesn't matter.
Okay.
And the best thing will be
Yeah,
that don't break during night. It is, I will advise you
yeah,
that if you want to sleep, suppose you get up, let's say 6 o'clock, okay, or 5:30 in the morning, then you will try to sleep right away, okay, after, let's say, prayer or something.
yeah,
And sometimes you might have difficulty in going back to sleep at that time. If you have difficulty, then try get up out of the bed. Don't lie down on the bed. The worst thing is that you don't have sleep and you are lying down on the bed. So
yeah,
don't do it. It's better that you do some other activities, do some exercise, make a breakfast for you or for your family, read some book, watch the television. These are the things, some activity. And you can make up your sleep, let's say 3 p.m. That's also fine. Okay. So that, let's say 6 hour or 5 hour, and then 2 hours in the afternoon. So that can make 7 hour. That I answer your question.
yeah, yeah. Thank you, doctor.
Okay. Right.
Yeah,
And
Doctor,
even, yes,
Dr. Assalamualaikum, it's Humayun.
yes.
You mentioned here from 18 to 64, 7 to 9 hours of good quality sleep, while for 65 plus, I mean for seniors, less number of hours. I thought it could be other way around.
No, that's a myth. Basically, the younger they need more sleep. Okay. The elderly by default, they don't, because of the work. It is variable. Even if you go to the lesser age, then the sleep duration will increase more. Okay. So in children or the infant, so the less is the age, more will be the sleep because of the growth and the other factors. Okay.
Okay.
Yes. So any other question? If somebody can tell me, because yes.
Yes, I have a question.
Sure.
Some people have an issue with sleeping, basically, and if they cannot sleep 7 to 8 hours, how they compensate that sleeplessness thing?
How they compensate what?
Not sleeping, because
Like,
some people cannot sleep. Some people have an issue to sleep 7 to 8 hours. Some people cannot sleep continuously because they have to go for urination after 1 or 2 hours, or so many other things. They cannot sleep well. So if the sleep requirement is not met, how they can compensate this issue?
okay. So basically, if some medical problem disturbing the sleep, then you need to seek your, like, discuss with your physician. If it is a non-medical problem, and medical problem include the psychiatric problem, one of the major reason for interrupted sleep, or once the patient wake up in the morning and never go back to the sleep, is the depression. So that is a psychiatric condition, and there are very good medication available. Sleeping pill should, by default, should not be used. You can use it for 2 to 3 days maximum, but not because of the addiction and because of the bad. So, as I told you, that if you are unable to go to the sleep, the best way is don't sleep. Just forget the sleep for the time being, and then do something else. And after some time, you will feel that now you are becoming sleepy, like reading some book, and then you can compensate your sleep. But the overall, a healthy adult of this age group, 65 plus, should have 7 to 8 hours. If they have less than that, it means that they may feel tiredness, or they may not be that fresh. So these are the recommendations. Okay. And sleep hygiene is also important for you. That what is the meaning of the sleep hygiene? Your bed, your room, your timing, your food, they should be synchronized. You should know that when I have to take, there should be a good timetable. If it is sleep hygiene is not maintained, sometimes this is a common reason for the sleep. Another common reason or common problem in the sleep disturbance, I'm not just one more sentence and then I will stop that because a lot of discussion, medical discussion, I don't want to go into the medical discussion, is the chronic sleep obstructive apnea. What is this? That the mostly in obese patient, they have what we called in Urdu kharate, and that kharate means that they have the noisy breathing during sleep. Their oxygen level is not appropriate and they have lack of oxygen, and that there is a multiple changes in the body, and that is a major reason for the high blood pressure. So if the sleep is obstructed, that irrespective of your blood pressure pill, your blood pressure will not be controlled. So it is important that you take care of your sleep properly. There should be no added. So basically, you should discuss your sleep with your physician. This is not something that you can, like if persistent problem, right? Okay. So this is the prevalence of common problem in Canadian population. And if you look the population, basically the blood pressure and the diabetes, they are on the top. Then we have the joint condition like osteoarthritis or the fragile bone, osteoporosis, we call it. And then even the psychiatric condition. And we also have chronic obstruction of the lung problem. It's more common in white population, 10%. And that can lead to some pneumonia or some other. In children, asthma is cancer is 8% in Canadian population, the prevalent, but this is the most common cause of death in Canada. Followed by cardiac diseases or the other. So if you add hypertension 25% plus coronary artery diseases or the heart attack 8%, so that becomes the major chunk. And so basically whatever program is designed for you, it is just for the protection of these two problems. Okay. Now, in the World Health Organization have given 12 tips for your. So I found this. Can you see my whole screen or it's obstructed?
Then it's okay.
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 Great. So there are 12 healthy tips. Number 1 is diet. Number 2 is exercise. Number 3, vaccination. Adult vaccination I'm talking about. I'm not talking about the basic vaccination program of the children. Number 3, minus tobacco. Number 5 is minus alcohol. Number 6, minus stress. Number 7, plus hygiene. Number 8, minus speed or drink. Number 9, seat belt and helmet. Number 10, safe sex. Number 11, monitor. Monitor means physical examination, annual physical. Number 12, for the babies, breastfeeding. So the WHO has identified these 12 world over. It has no ethnicity, no religion, nothing, no age. They said that irrespective of the age, irrespective of the sex, these 12 points are standard tips for your health. Okay. So that's the 12 tips to be healthy lifestyle. 1, 2, 3, 4. So there are various, they have written here, number 1, number 2, number 3, number 4, and so on. Now, what activities you should do, I explained you earlier in my lecture that there are 3 kind of physical activities. Number 1 is the weight bearing exercise, which develop your muscle and the joint more stronger. Second is the like stretching exercise. What are the stretching exercise? Stretching exercise are, for example, yoga, or for example, offering prayer. Prayer itself, when you lift from prostration, sajda, then you stretch your back. That is, if you cannot offer prayer on ground, you can offer prayer on like seat, on a chair. Take a hard chair and do the exercise. Before or after the prayer, you can use that time for the exercise. If you can play some sport or you can participate in a dance classes, that will be great. So sport and recreation are also recommended in Canadian side. And if you, I have seen in Toronto in the good time, if you go like in the summertime, that there are a park, and I have seen a lot of Japanese or the other people who are exercising in a group. And if you go to the community center, they are also like dancing and exercising. There are a lot of programs going on, and that is. But the best exercise will be aerobic exercise, and the aerobic exercise is one which increase your heart rate, and increase of your heart rate should be there. So what should be the increase? I will just write down here for a formula. If you have a paper, then you can write it down. So we are talking about aerobic exercise. So now what should be the quantity of the exercise? It should be 150 per week. Like for example, if you can do for 30-minute exercise, then 30 minutes, for example, you can do for 5 days. Okay, then that's fine. It's equal, same amount. Take your heart rate. For example, if your heart rate is let's say 70 beats per minute, then take your age. Okay, for example, if your age is 70 years, then there is a formula, and the formula is 220 minus age. Okay, so 220 minus age. So if it minus this, it becomes 150. That is the 80% of this is required. So if you calculate the 80% of this one, let me calculate it on calculator. So if somebody can calculate it. So 150, 80%, it should be 120.
Yeah.
120. So your heart rate, which was originally at rest, so this is the rest heart rate, right? When you were, and after the exercise, your heart rate should be 120 per minute. So it means that your exercise is called exercise rate. Okay, that's how you should understand that what is the meaning of heart activity, and it will increase circulation not only in your muscle, but it will increase circulation in your heart, in your lung, in your brain, in your kidney, all the vital organ. And that is important for you. Okay. And any question on this aerobic exercise? Because you can make it 15 minutes, if the 15 minutes, or you can make it 3 days only. So 3 days, 50 minutes for 3 days, so on. Okay. If you cannot make it for 150, you can make it 120, and then you gradually come to the minimum. More, the better. Okay. Now, environment should be good. Home, you can do it at home, work, community, indoor, outdoor, so any. Then the activity of the leisure. So this is important for everybody. It means that you should be in social contact. You should enjoy your social contact. You should enjoy the movies. You should enjoy the people around you and help them, ask them, and make transportation, occupation, household across all season. Uh, all these are included in your activities. Sedentary lifestyle. You should limit your sedentary behavior, like sitting or lying down on bed, and screen time. Okay. Somebody was asking about the sleep. If you cannot sleep, so if you cannot sleep, the sleep also come in sedentary lifestyle, like lying down on a bed with open eye is better to do some work. So it is better that you just, uh, if you are just watching some video or something, it is better that you do some other activity. Okay. Right. So I will go move on. So moderate or vigorous. So I explain you what is the meaning of aerobic physical activity, and these are some of the just ideas for you. And they say that 150 minutes a week is a minimum of what a healthy Canadian should do. Okay, so that is the. Now, what are the health benefit of the physical activity? Everybody knows it. I don't have to repeat it. You are more knowledgeable than me, and you know what are the physical activities. Basically, it burns your fat. It burns your calorie. So the calorie deposit and calories burn. So if the burning is less and deposit is more, it leads to obesity. And if the burn is more and deposit is less, then it leads to loss of weight. Okay, so it's a simple. You should be very careful when you are looking at the or taking anything. Suppose if you are drinking a juice, okay. For example, I have this. This is a pineapple juice. You can see here, and if this pineapple juice, it has calcium, it has iron. Try to understand and read the label. But the most important point is that how many calories are here and what is the amount of this. So the calories here are the sugar. It is the 22 calories, I guess that it is the 22 calories they have given per glass, but probably it should be more. So they said in this that the calories coming, let's say whatever you are drinking, what is the source of calories? Source of calories are only from carbohydrate in this juice. Okay, so that is important, that your source of calories are coming from carbohydrate, or it is coming from fat, or it's coming from protein. I will discuss that one as well. Shokasab, are you saying something?
No, that's okay. That's okay. Thank you.
Okay. So the health benefit of physical activity, it lower risk of obesity, risk of mortality or heart attack, cardiovascular. It lowers your blood pressure. It controls your diabetes. It less risk for the cancer, less risk of psychiatric problem, and Alzheimer. Less risk of adverse lipid profile. Adverse lipid profile means that bad cholesterol is more. It also help to prevent the fall. That is also, and in women, it improve postmenopausal osteoporosis. Cognition means that patient can recognize around, so the memory problem, dementia, and cognition, and the quality of life overall is improved. There are certain questions you should ask by yourself, that are you able to do the activities, number one, or you have difficulty, like what prevent you of doing this one? Are you able to do heavy work? For example, cleaning the window or washing window or something. Can you do the shopping, and can you able to get to places out of walking distance? So some long walk, okay, and your bathing and tub bath or shower, can you do it? Dress like. So these all activities we have discussed in the interview. Remember that we discussed. There is another one, and that is a simple test for you. Now, this simple test, we call it time up and go test, tug test. What is the tug test? The tug test is basically, if you remember, Anwar Iqbal Saab, we demonstrated this test in your meeting as well at the Cooper Mosque. So you just take a chair here, and then ask the patient, just move and then turn back and sit down. And this will evaluate that your joints are good or your joints are not good. The 10 feet distance. So this line, you can see it's the 10 feet line. So the distance between the chair and that you need to, it should be completed within 10 to 15 seconds. If you can complete it within 10 to 15 seconds, you are good. But if you take longer than that, then it means that you need attention to the doctor. Okay. So a referral could be the fall prevention services or physio referral, physio clinic, or some assisted device are required, because maybe you have some joint pain, you have difficulty in standing up and walking and then sitting again. So it could be the joint. The most commonly is this joint, knee joint, and then pelvic joint. Okay, these are the most common joint. Another common problem is in the neck joint, and the neck problem is either due to bad sleep, or by the habit on sitting in front of a screen. Joint problem, I will not go into the detail of these joint problem because these are the medical.
So can I add one thing here?
Sure.
You just talk about the speed. The new study is we have the vitals like blood pressure, heart rate, oxygen. So now the new vital is going to be your walking speed. This is the latest thing. So they will also measuring your, and the method to do something like it. So when you're measuring your blood pressure, heart rate, oxygen, right? So they will also measuring your walking speed. That tells a lot about your health.
Okay, thank you for that. Anybody else have the, so that we are doing only in the treadmill test for the heart rate. If there is a stress test, then we are doing that one.
Shakeel sir, Doctor, I have one question. You mentioned 10 feet briskly. So 10 feet one side or total going and coming back?
No. This is basically 10 feet going, 10 feet coming back. So
Oh,
the
20.
mark is 10 feet.
Okay.
That we call it rule of 10. So 10 feet has to be completed within 10 seconds. A good. Okay, so that's good. If you can do it, it means you don't have. Like you can ask that.
How many times you have to do it, also?
Pardon?
How many times you have to do that trip, 10 feet trip? Just one time?
One time.
Okay.
One time to assess your ability that you don't have any problem in the joint, or do you need these referral or you don't need. If suppose somebody
Normally,
can.
in practice, you take 3 measurements and take the average.
Exactly.
Normally.
Okay, we'll continue. So basically that is meant for the joint problem, that tug test. Now, there are certain things you can make if there is a pain in your joint, then you can try these things. You can reduce your weight. So losing weight will put pressure on your weight-bearing joint, especially the knee joint and the hip joint. Physical activity will help you to mobilize the joint. So the mobility of the joint is important. Mobility is difficult. Like you need to practice. For example, if I ask if you can do it by yourself, there's an movement of the shoulder joint, and then you can go all the up to here, for example, and then where you can feel the pain or no pain. Okay, so the stretching should be so that kind of thing will, you can evaluate that if you move all your joint, any joint is painful, and if painful, what level it is painful. Normally, if you go to the doctor, then we use it, we measure it in angle, and that measurement is called goniometry. Like so if it is, for example, it is 90 degree and this is 120 180 degree. Okay, so if there is a painful arc, we call it painful arc. Like the pain is in which arc, which angle the pain have the maximum. It could be in the hip, or it could be in the upper limb, for example, shoulder or other thing. Sometimes the pain could be due to the sport, for example, golf. Some people who are, we call it golfer elbow. So the pain is basically in the medial epicondyle, or medial this side of the bone, and the another is the tennis elbow. So tennis, if you are playing, then sometime it is here. So so any pain, and some carpal tunnel syndrome is also a very common problem. So make sure that you have any problem, then please seek advice from your doctor. Okay. Diabetes is a very common, and the general symptoms are like you should know that whether you are having diabetes or no. So always tired, number one. Frequent urination or increased amount of urine. You are losing weight for no reason, although you are eating. Wound is not healed, or there is a joint pain. You have the joint pain and the pain is not going. Okay, so that whenever you have the joint pain, think of diabetes. The problem with your diet, okay, so hungry, sexual problem, like you have no or erectile dysfunction, or so all these are related with the diabetes or atherosclerosis. Atherosclerosis is basically hypertension. It is the mother of all the cardiovascular diseases. Like their blood vessel, suppose there is a blood vessel, the blood vessel become narrow due to the deposit of the fat, and that is called atherosclerosis, because the penis also supply the blood to the penis, and then if it become block, then that will be number one reason to alarm you that maybe you have either blood pressure, atherosclerosis, or diabetes. Vision, you have problem in driving, especially at night time. Color perception, that could be. Vaginal infection in women, they are also the first sign for diabetes. Numbness or tingling sensation, uh, always like hungry, always thirsty. So that is also a reason for diabetes. So there are a lot of problems, and I discussed. Please visit to this website. It is the Diabetes Canada, and you will find a lot of stuff like the brochure you can download. You can there are a lot of information depending upon your own problem. If you are, God forbid, if you are having these problems. Another point is about the uh, diet, healthy food, and food is just diminished. So there is a bar. How can I minimize that bar on the top? I don't know that how to do it. Anyway, so a variety of healthy foods are required, and you can see here the it is always good to see this kind, but it is very difficult to maintain this kind of food. Okay, but try when you go to the supermarket or store, try not to go to these areas, bakery area. Okay, choose a good fat. Don't choose like fatty meat. You can choose milk, dairy, cheese. That's good. You can choose as many as you like vegetable, and as many as and whatever types of fruit, that is also okay, although they are sweet, but that is not. Eggs, nuts, they are important for you. You can use grain, whole grain bread, whole grain roti or naan, whatever, they are also good for you. Okay, you can use also the cereal, whole grain cereal. Okay, they are also good. You can add in the cereal milk, so you can make cereal. Then you can add in the cereal, you can add the milk, and you can add the nuts, and you can add some fruit. So in the breakfast, while you are taking boiled egg, you can add this thing. You can also take fried egg. There is no problem in the fried egg. If you like that one, you can take. That amount of fat is not going to harm you. The harming is this animal fat, extra fatty, that nihari kind of food, or katakat or brain masalas or kormas, like they are more harming than this. Okay, so that is the and multiple foods are required. You should measure your weight and height. It is every week you should measure, not daily, but every week you should have a measuring scale, weighing scale in your washroom, and please measure your weight. Okay.
Also, the question here, I think is the right time to answer. If you read the question about the difference between a good cholesterol and bad cholesterol, what is that? Somebody there. Aziz asking.
Okay, so the question was about the good cholesterol and the bad cholesterol. So the good cholesterol are those cholesterol which protect you from the heart diseases. They are also fat, and the cholesterol is required for your brain development, cholesterol is required for your hormone. So cholesterol should be taken. But there are different types of cholesterol. So that good cholesterol, they are known as, write it here, cholesterol. So we have the bad and good. So the bad are called, we call it low density lipoprotein cholesterol or very low density lipoprotein cholesterol. And good, we call it high density lipoprotein cholesterol. Okay, that's a difference. But for you, what is bad? So bad means, for example, fat. Okay, so this fat is a bad cholesterol. Majority of this is the fat. For example, good is the oil in fish, oil in nuts, oil in vegetable. And what are the vegetable oil? Like olive oil or what we call mustard oil. कहते हैं ना, सरसों का तेल. Okay, so these are vegetable oil. Versus we have some oil which is coming from the fat. So that fat oil is basically, we call it ghee. Okay, and then fat oil can be butter. So these are animal origin fat. So this is the bad cholesterol, and by default, if you have, let's say 100% cholesterol, so if 100% cholesterol, then out of this 100%, 25% should be HDL or good cholesterol. Okay. In other words, if you divide 100 by 25, so 25 is your good cholesterol and 100 is your total cholesterol. Total cholesterol. Okay. So then your answer should be 4. Okay. If it is less than 4, it's very good. Okay. It's very good. But if it is, your answer is, let's say 5. 5 means that your good cholesterol is 20. So instead of 25, it had dropped down to the 20 instead of 25. Now your total cholesterol is 100, same, but your good cholesterol has dropped to the 20. Now the answer will be more than 4. So the answer will be now 5. So it is important that you should maintain this ratio, like total cholesterol level, whatever is your total cholesterol. Then just compare it. What is the relation of total cholesterol with your good cholesterol? And what are the sources of good cholesterol? Nowadays, everybody has internet access. You can figure out in this. I hope I answer your question. And the Health Canada recommended that the ratio should be always less than 4.
Doctor, there's a question from Mr. Athar about coconut oil.
It is a bad cholesterol.
Okay, thank you.
Coconut is a bad cholesterol, and palm oil is also a bad cholesterol. Then that's the reason they are cheap. Any other question?
Yeah, Dr. Sabir, it's Humayun. 2 things. If somebody has a high good cholesterol, does it require good eating or exercises?
To be honest, both, but it is the choice of your fat, choice of your oil and food, because cholesterol is a fat. Okay, so when you choose some oil or fat, what is the source you are looking at? If you choose from the high good cholesterol, because if you increase your good cholesterol, okay, so suppose your good cholesterol, it is the total cholesterol 100, your good cholesterol become, and it is not 20, it is not 25, then it becomes 30. Okay. So you have increased by diet and a very careful selection of the. So what is the answer now? The answer is about 3.3. Okay. So it is always less than 4. Your health is very good.
Okay. The other question, Dr. Saab, is about the eggs. How many eggs per week or per day for the 8 plus 65 people?
You can eat uh, 2 eggs very safely per day.
2 eggs per day.
Yeah. Yes, per day.
Doctor, provided
We
you're not taking other.
We've always been told that eggs are full of cholesterol.
That is a myth. It is not. If you are worried about the cholesterol, then you can like make one. You can take at least one egg yolk and remove the another one. But please take 2 eggs. Absolutely fine. Nothing will happen to you. I can guarantee you. Egg is a
Thank
good. Yes. Any other question? So we have an example of Khan Saab, and Khan Saab is taking 6 eggs per day
I
for
think
the
it was,
last 60 years.
it was 12. It was 12, I remember last time. 12
Yeah.
eggs per day, but he does 1 hour of exercise. It's swimming at this age, or you don't know it. So it is
Yes.
not the egg only, it is a combination. The total
But
fat
even,
intake.
sir, his cholesterol level is also good.
Yeah, I know.
Like it's not bad.
That's very good.
Yes, right.
12 eggs every day. Yes.
Okay. Now, I think you all know that what is the current guideline for obesity. So take your weight. Suppose your weight is 70 kilo. Okay. And your height is, let's say, 1.6 meter. So you take a square of 1.6 meter. Okay. So I will use again my so 1.6
Take in fitted inches.
sorry.
Measure it in suppose feet and 5 feet, 6 feet, something like that. Height.
No. What is if you calculate it? Just I want to show you that what is 1.6 time. Just a minute. Let me measure it for you. So it becomes 2.5. Okay. So if you divide, suppose if you divide 70 by 2.5, then you get your BMI. So what is the body mass index? Body mass index become 28. It become 28. And now you can check. So basically 70 divided by 2.56. This is your height. This is your height. And this is your weight. Okay. So that's the how you should calculate it. Now, where you fall. So you fall here. Okay. So you know that between 25. In other words, if you make your weight, for example, instead of 60, so instead of let's say we bring it to 60 kilo. Your height, you cannot change your height, but you can change at least. This is the variable. This variable is under your control. So now let's see that what will be the result of this one. So if you divide 60 by 2.56, So that becomes 60 divided by 2.56. So it becomes 23.60 divided by 2.56. Now this becomes 23. Okay. Now, what is 23? So if you look in this table, the 23 means that you are in the normal. Okay. So this is how you should calculate.
Doctor,
So
one question.
Yeah.
We'll be having a Maghrib prayer, so what's the plan? You have how much time you need? You want to break or come back, or what you doing? Because soon we'll be having a Maghrib prayer. We can break and come back also. How do you?
I think you can take a break because I still want to finish. If you like, I want to finish this presentation because
Okay.
it's a good presentation and you all, it will be beneficial for all of you. Okay.
So should we take a break for 10 minutes or 15 minutes?
10
Okay.
minutes or 15, whatever you want.
I want to know from the participant. Some input.
You should come back 5:30.
5:30? Yeah.
5:30 means half an hour.
No, 5:16 now.
Break.
Yeah. Is it okay, Anwar sir?
Let's come back to 5:45.
I think that will be close to the Maghrib time. So I will just request if you can take just 10-minute break.
We're going.
We are taking break for Maghrib.
Maghrib.
Sir.
This is Maghrib time supposed to be now.
5:19.
That's what I'm
Oh.
saying. Come back 5:45.
So let's do that. Then 5:45. That will be a better time. So we can offer the Maghrib prayer or what is 5:30 is okay. You can offer everybody will offer 15 minutes is good for that prayer.
Okay, Anwar sir, any idea? You are the expert.
No, I'm not the expert, but I think 5:30 is looks to me sounds good.
You are the expert taking the breaks.
I'm always on a break.
Yeah. Anyway, so I think we'll come back at 5:30 and I will keep it on. So you don't have to relog or log out. It will stay as it is, right?
Okay. So